Hi, my name is Annette Dobbs, and this is the start of my abdominal, musculoskeletal, and neurological system reviews. First, we're going to start with the abdomen, just visually inspecting. It is round, it is positive for respirations, positive for pulsations, negative for peristalsis. The skin is smooth, there are no visible lesions or macules. There are a few striae along the side with a visible vascular pattern. The hair distribution is a normal male hair distribution of what we would expect. The umbilicus is inverted and there is no sign of a colon sign. After we visually inspect it, I'm going to auscultate the abdominal quadrants. And as I'm listening to hear bowel sounds in a normal ratio of about 5 to 35. And they are present in all 4 quadrants. We are now going to auscultate the liver. In the upper right quadrant, our spleen in the upper left quadrant, and no friction rubs are noted. We're then going to move on to our arteries. We're going to listen to the abdominal artery first, slightly left of the midline below the costal margin. I'm going to move to the renal arteries. And the iliac arteries. And no bruits are auscultated. Moving on to percussion, we're going to percuss all quadrants. You would expect to hear resonance or tympany. And then over the bladder, you would expect to hear dullness, and we do. After we have percussed our quadrants, we're going to percuss the liver. And with this, you would take a measuring tape and a pen. And we're noting resonance to dullness. We would make a mark. Tympany to dullness, make a mark. You would measure and expect to find 6 to 12 centimeters for a normal size percussible liver. We're now going to percuss for the spleen. And you would expect to hear resonance and dullness until you get to the costal margin, and then once you move under, you should hear tympany. The spleen should not be palpable. It should be tucked under the costal margin. So after we have percussed, we're going to now palpate. I'm going to ask you to take a deep breath and cough for me. Perfect. And the liver is able to be palpated. The margin is smooth. It is free of calcifications or ridges. We're also going to palpate our kidneys, and if you just relax. And they are freely movable. They are retroperitoneal, and we would do a Same on the other side. After we have palpated our liver, kidneys, the spleen is not palpable, we're going to palpate our quadrants. And we're going to lightly palpate, moving to a deeper palpation. And there are no abnormal palpable masses. No hernias noted, and no ballottement noted in the abdominal region. And that concludes our abdominal assessment. We're now going to move on to musculoskeletal. Moving down to the leg, if you would raise your leg for me. This is flexion, and if you would drop the leg, this is extension. We're going to do this against resistance up, and then against resistance down. Perfect. You're going to swing your leg out for abduction, and swing your leg in for adduction, and then again against resistance, and again in. Awesome. I ask you now to rotate your ankle in a circular motion. We're just testing range of motion in the ankle. And if you would turn your foot in for inversion, out for exversion. We're going to move to the knee. Bend your knee up for flexion and out for extension. And we would never hyperextend the knee. We're going to hyperextend the leg when we stand. And again against resistance, and again out for against resistance. Perfect. If you would point your toes for plantar flexion and pull them up for dorsal flexion. Perfect. And that is our lower extremities. You're going to put your heel into your knee. Perfect. And this is internal or external rotation, and point your knee to your knee for internal rotation. Perfect. If you would stand up for me, and I'm gonna actually switch spots with you and face me. Perfect. Kick your leg back for hyperextension. Perfect. Awesome. And that finishes the lower portion. We're gonna do flexion, chin to chin, extension, looking straight up, and hyperextension. We're going to rotate our neck for range of motion, and we're going to do lateral bending left to right. Perfect. And we're going to do this against resistance at forward and back, and left to right. Perfect. We're now going to act like you're diving, and this is flexion. Extension is by your sides, and hyperextension behind your back. Perfect. We're going to do external rotation behind your head, internal rotation behind your back. We're now going to, I feel like I don't have enough room, I'm sorry. If you would, we're going to move down to our lower extremities. We're going to do flexion, extension for your elbows, and if you would pull against me for resistance, awesome, and down for resistance. And we would never hyperextend the elbows. We're going to do abduction, and then we're going to do adduction in. And we're going to do this against resistance, and again down. Perfect. If you would, rotate your wrists. Perfect. So we're going to start with supination and pronation. We're going to do radial inversion and external rotation, or ulnar inversion. And you're going to do, this is adduction is out, and then adduction is in. Perfect. We're going to do flexion of the wrists, extension, hyperextension, And then we're going to do just our fingers. Flexion, extension, hyperextension. Do it again, just your fingers. Flexion, extension, hyperextension. That's great. And I'm going to get you to do this against, go down for flexion. Just your fingers. Perfect. And then up again. Awesome. And that completes just moving to your back side. I'm going to get you to stand beside me and do this. And this is opposition. Just making sure you can touch all and put your thumb into your pinkies. Perfect. If you would bend over, I'm going to check out your spine. And just looking at the spine, there are no signs of scoliosis, no signs of lordosis or kyphosis. Checking out the paravertebral muscles, they are intact. Awesome. And when you're bending over, this is flexion. When you're standing up, this is extension. And when you lean back, this is hyperextension. Great. And we're gonna, if you would, just walk normally across the room for me. Perfect. We're moving on to our neurological system. Oh, stay. And then you're gonna walk back heel to toe. Perfect. And then if you would face me. So we're going to do supination and pronation on our thighs as fast as you can. Perfect. And if you would put your arms out to the side and touch your nose. And then if you would do it with your eyes closed. Perfect. And I'm actually going to get you to sit. And I'm going to get you to try to cross your legs like a lady. You might have to sit back just a little bit. Perfect. Now try to cross your legs like a lady. All right, the other one. That was better. Perfect. And this is testing your quads, your glutes, and your hamstring muscles. We're now going to move on to point pant location. So I'm going to show you, this is smooth, this is sharp. You feel the difference? Mm-hmm. Okay, so I'm going to place it somewhere on an extremity, and you're going to say smooth, sharp, and then point where I'm doing it with your eyes closed. Mm-hmm.
Smooth.
Perfect.
Sharp.
Perfect.
Smooth.
Perfect.
Smooth.
Perfect. And we would also do it on your trunk. Alright, we're going to test vibration sense. And if you would close your eyes, I'm going to put a vibration on a joint. And you're going to tell me when that vibration stops.
Now. Now. Now.
Perfect. And that tests your sense of vibration. All right. We're now going to do position sense. So this is going to be up, neutral, and down. All right. So you're going to close your eyes, and I'm going to do it on a finger and a toe. So if you put your hands out in front of me, you tell me which position we're in.
Down. Middle. Up.
Awesome.
Up. Middle. Down. Up.
Awesome. Grab my 2-point thing. Alright, we're now going to do a 2-point location test. So I want you to tell me the difference between 2 points And 1 point with your eyes closed. Put your arms out in front of you, please.
2 point. 2 point. 1 point. 2 point. 2 point.
Okay.
2 point. 2 point. 1 point.
Perfect. And that was graphesthesia. We're now going to do stereogenesis, and this is identifying items with your eyes closed. If you'd put your hands out for me, and just tell me what you think this item is.
A coin.
Okay.
A key.
Perfect. And we're now, you can open your eyes. We're going to test your reflexes. And if you would just relax for me. Hold your arm up. And this is your tricep muscle. Moving down to your bicep. And then we're going to do your radial and your ulnar. Alright. Ideally you would be sitting on an examination table with your leg up in the air. And we would do your patellar. And then if you would stand up and sit on the couch on your knees, we would do your Achilles. And these results are +1. And I think we're done. Thank you so much.